Hi, Dr. Kevin Windisch from Sparks Pediatric and Adolescent Medicine again. Welcome to our video series for students and professionals. Remember that these are not intended to replace your medical education, but merely enhance that. If we can be of assistance for you here in our office, either with consultations on patients or for scheduling rotations, please give us a call at 775-359-7111. So today what we want to talk about is some of the components of sports physicals, and the real impetus behind this is Nevada, where I live, has recently changed a law that will allow mid-levels, specifically nurse practitioners, to sign sports physical exams for the state of Nevada, and that's probably a good thing, seeing as they're doing the exams anyway. They should be able to sign the paperwork. But from some of my friends who practice in the field, there's some concern about, gee, what are we doing? We haven't done sports physicals in years, so could you please fill in the gap? So we're going to do that for you today. The first thing I'd like to emphasize to anybody who's doing sports physicals is realistically, a sports physical should be a comprehensive wellness exam like any other appropriate for age, with a little bit of emphasis on physical. It should not be, or a little bit of emphasis on sports and athletics. It should not be an assembly line going down the room, turn your head and cough, turn your head and cough, next, next, next. And it really needs to be done by a provider that knows the patient and has an ongoing relationship with the patient. You're not being paid for your signature on the form, you're being paid for your thoroughness and for your relationship with the patient. And this really needs to be primary care in its truest and completest definition, meaning ongoing regular relationships. Doing these via urgent cares and dock in the boxes is probably not an appropriate place to be doing pre-participation sports physicals. As such, this should be no different than any other teenage wellness exam, and because most of these kids where you're signing the forms are teenagers, that means you need to include a thorough history and physical. You need attention to the past medical history, attention to the history of present illness, and a heads assessment, which means teenager with no parent and nobody else in the exam room, with emphasis on the fact that there is confidentiality unless you say you're going to hurt yourself or hurt somebody else or somebody's hurting you. You then go through and ask the patients the appropriate questions for an adolescent assessment as you were taught in your physical exam class way back when. H stands for home. Where do you live? Especially if you're dealing with older teens who may or may not be living at home. Is home safe? The E is for education. What grade are you in? How is school going? What grades are you getting? For older teens, what are your plans when you leave high school? Or for my college students, what are your plans when you leave college? A stands for activities. What are you doing when you're not in class? That includes work, gangs, playing with friends, playing sports, whatever. D stands for drug use, including alcohol and tobacco. S stands for sexuality, including sexual activity, use of birth control, concerns about STDs, concerns about pregnancy, menstrual history for girls. There's actually two S's in heads. Second one is for suicidality and homicidality. So you need to address that. You ever feel like hurting yourself, hurt somebody else, somebody hurting you, and that needs to be addressed. Then your complete head-to-toe physical. These are teenagers, generally speaking, but again, they're still pediatric patients as such. Height, weight, body mass index, plotted on appropriate growth charts. If you didn't plot it on a growth chart, then you didn't measure it. Simply writing a height and weight in a chart on a 15, 16, 17-year-old is worthless unless you know where that is compared to age and gender-matched controls. So plot it out. Address vaccine record, and make sure we address vaccination, in particular tetanus and meningococcus. And emphasis on, I think, human papillomavirus prevention as well, but specifically relative to athletes, tetanus and meningococcus, and any other vaccine that they're due for. I also recommend flu vaccines, especially for kids who are playing winter sports. You're indoors in a gymnasium spreading disease. You don't want to miss the whole season because you got influenza. Then your physical. Okay, your physical is a general, age-appropriate, head-to-toe physical with attention to all of the parts that you would ordinarily give attention to. And in a teenage sexually active female patient who's got concerns about STDs, that includes a gynecologic exam, it includes a hernia check, Tanner staging, which we can talk about Tanner staging later in a subsequent video if we need to. But there are a couple of components that are a little bit different if you're doing a pre-participation sports physical for both the history and the physical, and that's what we want to address now. And one of my older patients has been kind enough to serve as a demonstrator for us so that we can you don't have to look at me do this. So historically, or history-wise, the big thing to ask that you wouldn't necessarily normally ask is, do you have a history of loss of consciousness? Do you have a history of chest pain with exercise? Do you have a family history of sudden cardiac death? A yes on any of those things merits additional screening, and especially if you don't know the patient well, especially if you do not have a long-term relationship with the patient, that should reflex you to send the patient to cardiology for additional evaluation. I've asked those questions hundreds of times. I've only once gotten a positive on it. That particular patient went around me and got somebody else to give him the signature. I wouldn't give the signature. That particular patient didn't survive his freshman year of high school football. So those questions are important. Physical exam is a general head-to-toe physical. Again, attention to any medical problems. The two big areas that are a little bit different. One is cardiac. So you're going to do a normal cardiac exam like anything else, but the big thing you're looking for on cardiac exam is IHSS, or idiopathic hypertrophic subaortic stenosis. That may or may not present with chest pain with exercise. But a couple of maneuvers as you're listening to the patient, and you can do this supine. Ordinarily, the patient wouldn't have a shirt on. In Brant's case, we're going to leave his shirt on because this is an educational video. We would ask the patient, however, can you just bend forward at the waist? Way forward. Good. That brings the heart forward, and it's simply going to increase the loudness of any murmurs. In particular, you're listening for systolic murmurs. Okay, then you can have the patient stand up. Come on down so you don't fall. And I'm going to have you just squat down while you auscultate. That'll increase systemic venous return. Okay, you can stand up, and that'll accentuate any cardiac murmurs that may be present. And again, specifically, you're listening for IHSS. Statistically, IHSS is really rare. What is not so rare is prolonged QT syndrome. Unfortunately, there's no physical exam findings for prolonged QT syndrome. That's where the family history of sudden cardiac death comes into play. And that one's not quite so rare as we're finding out. But as you may or may not know, there's a lot we don't know about IHSS, and probably a lot of missed cases. The next thing that is a little bit different in a sports physical or pre-participation sports physical is the orthopedic assessment. And there's a technique known as the 2-minute or 5-minute orthopedic assessment for pre-participation sports physical, so we're going to walk through that. And so you don't have to watch me. I'm going to demonstrate for Brant, and Brant's going to demonstrate back for you. So for this one, you need to stand up. I'll have you just face the camera. Okay. And so first thing we're going to do is check the neck. So I'm going to have you look all the way up at the ceiling. Good. All the way down at the floor. All the way out to your right. All the way out to your left. Good. Touch your ear to your left shoulder and ear to your right shoulder. Okay, so that goes through the neck. Next is going to be the arms. Put your arms up over your head. Okay. Arms down in front of you. Bend your elbows all the way up. Straighten them all the way up. Bend your wrists all the way up. Straighten your wrists all the way back. Rotate your wrists around. Open your fingers and close them. Okay, good. Next, we're going to look at the hips. And that one's going to be really simple. Hips and lower extremities. So we're going to start. I'm going to have you just walk on your tiptoes a little bit towards the camera. Ordinarily, you would do this with shoes off. Okay, good. That's all we need. But again, for the sake of demonstration, because this is an educational video, Brant's going to be fully clothed for us. And then I'm going to have you walk on your heels just a couple of steps. Okay, very good. And then I'm going to have you back up so you have a little room for this one. The last one is going to check for strength in the lower extremities, in particular in the flexors of the hips and the leg. So we're going to have you get down, and we're going to do what's called a duck walk. They probably made you do this up and down the field perfect in soccer. And then the last thing, if you haven't done it as a scoliosis check, we have that as a separate video, so you can watch that video separately. Thanks, Brant. And then, again, the rest of your exam. Make sure you address general wellness stuff with the patient, including anticipatory guidance, age appropriate for the patient. And at a pre-participation sports physical, I also recommend addressing anticipatory guidance regarding common sports injuries, sprains, strains, when to come to the doctor, basic first aid, not trying to work out through a sprain unless you turn a grade 1 sprain into a grade 4 sprain, head injury in patients that are playing contact sports and how to address those and when to come see a doctor after head injury, stuff like that. And again, because this may be the only exam this patient is getting for the year, address the other age-appropriate anticipatory guidance, regardless of whether this is a pre-participation sports physical. Finish up with vaccination for your patient, and arrange follow-up time. So I hope this walks you through everything and you feel a little more comfortable with this. This is actually a very positive change for the state of Nevada because the Nevada wasn't NRS, Nevada Administrative Code that forbade this was ridiculous. So I'm glad to see this change finally happening and bring us into the modern age here in the state, and hopefully makes you feel comfortable. If we can be of any assistance here, again, give us a call at 775-359-7111. We'll see you next time.